Assalamu alaikum. My name is Dr. Tahir from DVM 9th semester uvas. Today, our presentation is about chronic endometritis and pyometra causing systemic illness in a production. So, I have extracted the material from the source Clinical Theriogenology 2023, Volume 15, Article 9806. Firstly, I will want to introduce about my topic of presentation. We all know that in this show, reproductive issues like pyometra and endometritis are poorly defined. We cannot identify them by ultrasonography or by other techniques. It is very difficult. Reproductive diseases in the show are leading causes for culling. This report is a chronic non-puerperal endometritis with pyometra in a production sow. So let's discuss with the case background. The sow was in its second parity and 5-day inaptitude and lethargy unresponsive to the treatment. So the veterinarian goes for the ultrasonography and ultrasonography revealed fluid-filled abdominal organs. Pregnancy suspected initially because corpus luteums were found at the ovary right and left both. But going with the treatment, there was no improvement, and after 5 days, veterinarian decided for to be euthanized because of no proper improvement and there was no viable pregnancy. Okay. So we will discuss about the clinical and diagnostic findings. Temperature remains almost 103.2, pulse almost 100 plus beat per minute, and mild abdominal distension was clinically observed. Ultrasound showed hyperechoic intrauterine fluid, no fits is present. Basically, we already discussed that there was some chances of pregnancy as pregnancy being suspected, but ultrasound confirms it with that it was just hyperechoic intrauterine fluid. Fluid aspiration yielded turbid pus confirming uterine involvement. That's the point of the case, means it was something endometritis and with now we will discuss about the postmortem and the histopathology. Closed pyometra with severe lymphoplasmocytic endometritis and salpingitis. यूट्राइन हार्न्स ऑलमोस्ट 20 सेंटीमीटर के थे और कंप्रेसिंग विजरा था, फ्लूइड टर्बिड था उसका. जब हमने उसकी हिस्टोलॉजी की तो हमने एंडोमेट्रियल ग्लैंड्स की डायलेशन देखी और हमने इन्फ्लेमेटरी इन्फिल्ट्रेट्स देखे और वेस्कुलर कंजेशंस देखी. This was the postmortem and the histopathology observations of that case. Now we will discuss about the bacteriology and cytology examination. Actinomyces hyovaginalis isolated from the uterine fluid. The uterine fluid that was collected during the postmortem observations. We performed cytology examination on that postmortem uterine fluid, and we observed actinomyces hyovaginalis. One thing that is to be noted that this bacteria is very uncommon in the source. Proteus species cultured from the lymph nodes, swabs, cytology mixed neutrophil and lymphoplasmocytic inflammations, bacterial sepsis. That was about the whole the bacteriology and the cytology examination of that case. Now we will discuss about the systemic effects and the pathophysiology. Functional corpus luteum cause cervical closure. We observed during the ultrasonograph that suspected pregnancy was there. This was because of the corpus luteum present on the right and left ovary. और इसकी वजह से जो सर्विकल क्लोजर था वो हो चुका था, फ्लूइड अकामुलेशन अंदर हुई जिसकी वजह से पायोमेट्रा बन गया. पायोमेट्रा बनने के बाद यहाँ पे फीवर हुआ, लिम्फेडिनाइटिस हुआ, नेफ्राइटिस हुआ और उसके बाद बैक्टीरियल डिसेमिनेशंस हो गई. गैस्ट्रिक अल्सरेशन एंड क्रॉनिक इन्फ्लेमेशन इन दोनों सिचुएशंस ने भी यहाँ से अपना आगाज़ किया. दैट वाज द सिस्टेमिक इफेक्ट्स एंड द पैथोफिजियोलॉजी दैट वाज एक्चुअली हैपनिंग ड्यूरिंग दिस case. Now we will discuss about the case. What is pyometra? Basically, pyometra is defined as accumulation of the purulent uterine fluid under influence of functional corpus luteum. Chronic endometritis characterized by plasma cell and lymphocyte infiltration. This is the basic difference between the endometritis and the pyometra. Pyometra is the purulent accumulation of purulent uterine fluid, but when it is characterized by the plasma cells and lymphocytes infiltration, it is called as chronic endometritis. Actinomyces species we already discussed that we found in the uterine fluids. In this case, likely underreported cause of endometrial infection in pigs. Means basically, I want to tell you that we observed actinomyces species, and according to the literatures, this species is very uncommon for the causes of endometrial infection in pigs. Now we will discuss about the outcomes and the key learning points of this case. So euthanized due to chronic diseases and poor reproductive prognosis. Highlights diagnostic challenges of uterine diseases and cause. Histopathology is essential for definite classification and diagnosis. Basically, in this case, the sow was euthanized. And euthanized because we were not able to properly identify and properly diagnose what was the reason behind this chronic endometritis and purulent pyometras. Now these are the references from where I extracted the whole material and literature. University of California, Davis University of Missouri Veterinary Health Center, and all these are mentioned here in the PPT. Thank you very much. Hope this lecture will be very useful for to all of you.